Good morning. We are here this morning in preparation for testing today from 9 to 1. And prior to our patients getting in for their testing, we lay out our antigens here. And each patient, when they do come in, has a clipboard where we have them write their baseline symptoms. And we help them determine what are the causes of their allergies, whether it be food, chemical, inhalants such as tree, grass, weed, mold, or chemicals. And we invite you to join us this morning as our patient will soon arrive and view the testing procedure. Good morning, Jack. How are you this morning?
Good.
Good. And we're continuing on our testing. And you know, when you come in for testing, we always like to determine what your allergies are and what's causing them. And the first thing we do is having you come in and let us know how you're feeling. Are you having any symptoms right now?
No.
No symptoms. Okay, so we're going to continue on. We had a problem with apple last time, so we're going to continue on with apple. And I'm going to wipe your arm. Although I already wiped it, we're going to wipe it again, okay, with a nice soft solution. I don't want to wipe Mickey here. Okay, and you know, Jack, while we've been in this process, we've determined what you're sensitive to, like the trees and grasses and weeds. Do you feel like you're feeling a little bit better? Okay, good. So we're just going to put a little test under your skin here, just like that. And we're going to mark it. And we're going to write our time. And Jack, as you know, we have you come up every 5 minutes to see what we're having a reaction to and see if you're having any symptoms. So you are highly sensitive to the trees, grasses, weeds. We noticed some foods. And we're going to continue on with our mold testing. And you're pretty sensitive with the molds as well, right? Okay, very good. All right, so at this point, we're going to have you take a seat and we're going to wait 5 minutes. Okay? You know, Holly, when you first gave us a call,
yes,
there were some concerns you had for Jack. What were some of your concerns?
He had 2 bouts of pneumonia. He had already missed 18 days of school. He just time after time he was sick with sinus infection, a cold. It was always something that he was sick with. He was waking up coughing. He sneezed and just so much stuff was coming out. He was so unhappy. Okay. And we needed another chance of something.
Okay, so try to determine what might be causing some of those symptoms.
Yes.
Okay, so when we started testing, I know we determined that it was really sensitive with the trees, grasses, weeds, and during testing, the constant blowing. How's he doing with that?
He has not coughed once in over about 2 weeks. Waking up, he wakes up refreshed, no nose blowing. When he sneezes, doesn't need a tissue right away all the time anymore. That's great. Our breathing treatments have gone considerably down. We used to do a breathing treatment almost every single day.
So how often are you doing breathing treatments now?
It was a week between
great.
breathing treatments.
Excellent. And we're in high pollen count right now,
yes,
so he's doing much better.
Yes, and no inhaler during that time either.
Okay, great.
Not even a little help.
Excellent.
So it's been amazing.
Excellent.
It's been amazing.
Oh, I'm so pleased. I'm proud of your hard work.
Thank you.
Yeah.
We are just so happy.
Now,
he's
and you brought
a better
in this
boy.
For, of what some of the foods we're eating.
Yes.
Okay, very good.
So that way we can journal it and see, just like you saw the cheeses were a factor.
Okay.
So we've cut down the cheeses a lot.
Okay, good.
Not 100% yet, but a lot, and that's been a big difference.
Oh, wonderful.
And looking for citric acid.
Right, and citric acid is a mold. It's not citrus, but citric acid actually comes from aspergillus.
Okay.
Okay. Okay.
Sorry.
All right.
So he did have some cheese here.
Okay.
But most of the time he had nachos here with salsa.
Okay.
But we've been cutting down the cheese a lot. We've been making things homemade a lot, so we're losing the preservatives.
Excellent.
And it's just made a whole big difference. He had a breathing treatment here, and then not until Tuesday,
Excellent.
a week apart.
That's
and this
good.
was just a preventative.
Okay.
Last histamine shot was last Tuesday.
Excellent.
So it's been a week and a half
Very
since we've
good.
had to do a histamine
Oh,
shot.
I'm so happy for you.
Yeah,
Very good.
I am too.
Very good.
I am too, and just all the natural, the vitamin C,
Good.
the natural stuff that you guys recommended is working awesome.
Very good.
I'm very happy.
Oh, I'm pleased with your hard work. And Jack, we couldn't do it without you. All right, Jack, it's been 5 minutes. All right, we don't have a reaction there, so we have our treatment dose. So I'm going to mark that. Any changes from how you're feeling when you first came in? Okay, very good. All right. We're going to continue on with mite mix, and this is dust mites. All right, and once again, Jack, we're going to just put a little test shot here under the first few layers of your skin. There you go. All right, and Jack, it's going to be another 5 minutes. And that completes our process in terms of a demonstration for our allergy testing for young folks.